Good afternoon. I'm Michelle Francis, Executive Director of the Office of Health Information Technology in the Office of the Governor. And I am excited to come to you today from the Charles Turnbull Library, where we've just concluded our USVI Digital Health Summit 2022. So, what was the Digital Health Summit? It was our first summit held right here in the territory to bring in nationally renowned leaders in health IT and speakers from across the country to have our providers hear directly from the experts. We're used to flying out for everything from our vacations to our education to our health care. So this time we brought the experts in. We spent a day and a half focused on things related to the health information exchange, to telehealth, telemedicine, and more. And we'll dive into what those things mean and what they mean to you. Some of the topics we covered specifically included funding opportunities, included regulations that guide us in the area of health IT. We also had some laughter around some of the sucks we saw at the summit, but we had a fun time in general. Presenters included a wide variety of companies, including the Project Management Office for the Health Information Exchange, Public Consulting Group. We also had Zing Technologies here, SwiMed, who is powering the telehealth module at Department of Health, and we had over 20 exhibitors and sponsors. So it was an exciting event. Here with me today is Luigi LeBlanc, who is Vice President of Technology for Zing Technologies. Luigi, how are you doing?
Good afternoon, Director. I'm doing well.
Good afternoon to you. So we're going to jump in with what were some of your key takeaways from the summit, and if you could share a little bit about the topics that we heard about over the last day and a half.
But first, let me begin by just congratulating you on such a successful summit. It was really an opportunity to have a group of experts meet with your policy leaders. Your governor was welcoming to share with us about the vision of the Virgin Islands. And you could tell that there was such passion in the room that everyone who came to provide support and exhibit were here in full of spirit. And so as a result, the themes that came out of the summit were focused around patient-centeredness, accessibility, ease of use. We talked about and we heard about the move from individualized care to population health care. And certainly the need and the interest was there from your providers on island to make a move to put together a health information exchange that's going to foster coordination of care and coordination of services to benefit the residents of the Virgin Islands.
You just mentioned two things that I think those watching today would want to understand more about. Patient-centered care being one of them. Maybe talk a little bit about what we've experienced before and what does patient-centered care look like and what should it look like here in the USVI?
So traditionally, healthcare is you go to get health services when you are sick or when you need healthcare services, and the system is moving into a model where services come to me as the consumer, and the care is around me. And so it's not just my health services, but it's my social support. It's my social determinants of health. It's those factors that create sickness. So as a result, the preventative strategies help to support and center around the individuals. Technology supports that and helps to facilitate it, but it really is about decentralizing healthcare and bringing it to the consumer.
You also mentioned that this is supported from the highest office, which is the governor, who established the Office of Health Information Technology. Part of our strategic plan was to put in place an annual summit where we could bring resources right here to the USVI. So a question for you is, what ways did this summit support the variety of critical health initiatives here, right here in the territory?
Well, first of all, you guys knocked it out the park, that's for sure. And some of the things that we've heard is around being able to get access to services, access to care, specialty care, particularly in around climate events. And so when the hurricanes occur, and naturally services aren't available, utilities go down, and when they come back up, you want to be able to have those services be responsive and rapidly available. So you guys have already taken the lead. You've implemented this Pulse service that is there during disaster preparedness. So at the time of an event, you're able to get these emergency information and data about residents. We've heard from your Office of Bureau of Information Technology and your Next Generation Network about what they're doing to make the island more resilient from an infrastructure perspective. So I think those are all benchmarks of a pathway forward that's successful. And so kudos to you guys on the island.
Thank you. And I'm glad you highlighted that not only did we have folks come in, but those that came to the territory were able to hear from Department of Health, Department of Human Services, Bureau of Information Technology, VINGN, to learn what middle mile means versus last mile. Last mile is where the technology comes to your doorstep. Middle mile is our fiber optic network that supports us. And we were able to establish that we've got a network in place to support technology investments. So what are some of the projects that could emerge from this summit, from this point where we've brought everyone together, we've shared important information, we had representatives from Center of Medicaid and Medicare, we had the Deputy Director of Technology from Office of the National Coordinator, Ryan Argentieri, as well as our governor himself, giving us a charge that yes, the goal is patient-centered care in the 21st century. So what are some projects that could or should emerge? What should we focus on?
One of the exciting sessions I thought today focused on workforce development and frontline workers, and it was very exciting to hear from University of Virgin Islands and the Department of Health and the efforts on the way around the community health workers. And they're frontline first responders, and we saw that during COVID. And so being able to have community health workers enabled with tools that are gonna reach the last mile, they're gonna reach consumers and screen them at the point of care and understand what their factors are, behavioral health risk factors, and link them to care are very exciting initiatives on the way. And that's just one of many. Certainly the providers on island, through the data demonstrated today in terms of your assessment survey you did of the providers, demonstrated that they're enthused about the possibilities of coordination of care and being able to refer appropriately for services. And so those types of initiatives I think are well-grounded and easy, not easily to implement, but the ground is fertile, the enthusiasm is there, the providers are ready, the health systems want to share information. And so those types of things I think are very exciting, very promising.
Yes, and to your point, we heard from both the CEOs of Juan Luis Hospital and Roy Lester Schneider Hospital. We heard from our FQHCs, and everyone seemed very engaged and ready to take the next step with telehealth, with the health information exchange, with data and what we do with our data and harnessing data. So those are some of the highlights I took away. So can you give me your top 2 or 3 highlights of the summit?
So the enthusiasm holistically of everyone here, those of us who are visiting and those of you who live here in this beautiful island, is probably the key highlight for me. I think that connectedness, that human connectedness, I don't know if it's an impact of COVID or the combination of this promise and getting out of a pandemic or transitioning out of it makes it a really special event. So that was one key highlight. The readiness of the health systems and your medical society and your providers to share information that benefits residents, I think is absolutely the gold mark of this, and that should be the standard. And so looking forward to momentum and to seeing how this progresses.
So a final question for you. Will you come back next year? So it's a 2-part question. And what would you want to see in a summit next year? Where does this go from here?
Well, I think the governor gave us a mandate. He told everybody, we'll see you next year. So the answer is yes. Ready to come?
Governor said so.
That's right. We've got to make sure that he's happy. And I think what we're seeing around the momentum nationally around public health infrastructure and workforce development are going to be key, because there's going to be funding that comes out that supports that. And if the territory can benefit from those, seeing how that is going to help to enable information exchange and to enable coordination of services with a twist on human services, public health, I'm personally interested in that and would love to see that move forward.
Thank you so much. Thank you for coming. We're going to be talking in the in-between, of course, as we have. And you failed to mention, but I'll highlight that you were here, and maybe not here, but involved in our first telehealth system in the 1990s. And when we return, Dr. Ernest Carter is going to share with us, and we're also going to hear from Public Consulting Group and what they're doing to help us stand up our HIE.
Thank you, Director.
Hi, I'm Justa Encarnacion, Commissioner for the Virgin Islands Department of Health. On behalf of other providers and professionals working in the health IT space, let me invite you to our beautiful island of St. Thomas for the first annual Digital Health Summit to be held July 25th to July 27th. The healthcare industry is going through a phenomenal period of change. With technologies, our patients, customers, and communities are presented with endless possibilities. This conference was created for folks like you and me across the industry, working to improve the quality of patient care. The summit's website, ohitusvi.com, can provide you with additional information and help you register as our guest, an exhibitor, or event sponsor. So join us this summer and let's learn how to harness emerging technologies here in the territory to transform the ways we deliver and experience healthcare. Can't wait to meet you.
Babe, I got that medicine. I'm on my way home now. They also have some Alcalado, so I picked that up too.
Wait, did you get the right one? You know Kyra likes the grape flavor better, and she's so fussy right now.
Yes, Jay, I got the grape flavor. I also called Ma, and she said to wipe her face with a cool rag until I got home.
All right, babe. Hopefully, we can all get some sleep tonight.
I know, right? Kyra will be okay, babe. I'll be home in 2 minutes.
Wait, is that the seatbelt alert? Why aren't you wearing your seatbelt?
Man, Jay, don't start. The seatbelt ain't that big of a deal. I didn't see any police on the road.
You know that makes me nervous. Tickets aren't the only problem with not wearing a seatbelt.
I'm right around the corner.
Buckle up. It's your life. It's our law. This message is brought to you by the Virgin Islands Office of Highway Safety.
Welcome back. We're coming to you today from the Charles Turnbull Library, where we've just concluded our first USVI Digital Health Summit. And we're coming back to talk about the Health Information Exchange. We heard a lot during the summit about what guides us, what regulations we need to be aware of, what funding opportunities exist. And here to talk to us about how they're going to help the USVI stay in line with all regulations and help us find funding is Fred Forer from our Project Management Office, Public Consulting Group, or PCG. Fred, welcome.
Thank you. Pleased to be here.
Tell us about your role in the USVI with the Medicaid office and with the Health Information Exchange.
Sure. Well, we're in charge of the PMO, and so we're responsible for all aspects of the program, from research and planning to procurement, through procurement and installation and post-installation. And so we're really cradle to grave on the project.
us what the health information exchange is. So for people who don't know,
Sure.
we tend to talk in terms that we understand, but what is that and what does it mean for the general public?
Sure. So the health information exchange basically means our healthcare providers can exchange information, medical information, amongst one another. They don't have to be in the same hospital or the same provider. They're from disparate providers, and they're able to share information and share, most importantly, medical records. So where that would come into play is, say, for example, a couple of years ago, you had a hurricane, and some people get evacuated from one island to the next. Okay, chances are their medical records aren't with them. They can't get them. You can't get a hold of the hospital. What are you going to do? Well, with a health insurance exchange, that information is available online. And because it's stored in the cloud, it's automatically available. So that's, for the folks in the USVI, that's a very real use case.
That is not only real, it is a reality of what happened a few years ago. But another reality is a daily one where
Daily.
folks tend to leave for specialty care
Right.
that we can't find here.
Right.
And we've heard again and again from community members the hardship in taking all of your medications and your medical history, being able to find some way, whether electronically or still in paper form, to take your health records with you.
Right.
Instead of them following you, you're carting them along.
Right.
So what you're saying is the health information exchange enables a variety of doctors providing you care to basically talk to one another.
Yeah, and it's not just the records, but enabling the continuity of care, and for them to know instantly what some other doctor has done or diagnosed for you, and what implication that may have for your health care.
Very important. So what would you say the HIE, when it stood up, we're talking about possibly a 3-year timeline. I know we don't want to set ourselves up for failure by overpromising and underdelivering. We have a number of steps. But what will the HIE help accomplish? I think you were talking about care coordination being a core component of what can be accomplished.
Yeah, care coordination is at the heart of the HIE. That's what it is all about. And that means essentially that one doctor knows what the other doctor is doing and can coordinate the care. It also means you don't have to get duplicate tests. You don't get duplicate medication or medication that conflicts with one another. All sorts of benefits to a system like this.
Benefits both for the patient and the provider.
Right.
So that it eliminates some of the guesswork when they are seeing a new patient, when they can track their history. We'll go back to a little bit of the timeline. Can you tell us a little bit about the roadmap and where we are in the USVI as you guide us in our journey towards a functioning HIE?
Sure. Well, we're in the initial stages, and so we've secured some funding for planning, and so that literally was just delivered to us this week, so good news there. And really, this summit has opened our eyes and opened your eyes to all of the possibilities. And so now we need to huddle up and establish our priorities. Yeah. What do we want to do first, second, third, and then get at it. I think, well, yeah, I'll leave it there.
Well, I know that members of the PCG team had great conversations. You guys led a session on HIE governance, which is a key starting point.
Right.
Bringing the right stakeholders. What else does that involve? What does governance involve?
Well, governance means how the program is going to be run. And there's a couple different models. There's a public sector model, there's a private sector model, there's combined. It's really who guides your activities and, in essence, also who funds your activities. Because if you're going to have a heavily private governance structure, it might require more funding from the government, from private sector.
Private sectors,
Private
yeah.
sector. So, yeah.
Yeah, and that came up. I got to sit in on part of that session as we worked through this, because Medicaid right now is the primary funder. Yet we still need the variety of stakeholders represented in the various institutions, as well as the general public, to be involved in the conversation, especially around data governance, all the data that's going to pass through the HIE and what we do with it. I don't know if there's anything you want to talk about in terms of data and any guidance you'll be giving to the USVI in terms of how
we're going to
govern.
work closely with you on the data governance. It's really important. And what's especially important about it is those rules get established early. And they can change over time as needed, but it's important to have the rules established early on so you know what you're signing up for.
Yes, yes. Thank you for that. What role do you think the summit played in not only supporting the HIE, but just health information technology and pushing it forward?
Yeah, well, I see a couple things. One, you had all the vendors come to you. And that's a lot different than you going to the vendors. And very, very powerful and very effective. So congratulations on a successful summit.
Thank you.
Yeah.
Thank you. It was exciting to have not only the other vendors, but to have the team that we've been working hand in glove with, Director Gary Smith from Medicaid, and myself, speak to your team on a weekly basis, but everyone else doesn't have access to those conversations. So for me, it was incredible to pull our hospital leadership, our FQHC leadership, our private providers into these conversations.
Yeah.
We appreciate the sponsorship. You guys came in as our headline sponsor, and I say that because that's so important for us. It's important for the investment, and we couldn't do the things we do without investment that doesn't just come from public funding, but from the private sector. And you being a partner with us is much better than just having a consulting firm. That's what we aim for here in the USVI. I don't know if there's anything you want to say about partnership.
We're very excited to be involved in the health insurance exchange, or health information exchange, excuse me, with you. We believe in the importance of the project, and we look forward to being a part of the solution that's going to bring better health care and bring the health care into the 21st century for the people of USVI. So we're pleased to be the sponsor and contribute in a way.
Thank you so much. Thank you for being here. We're going to have another segment where we talk about telehealth. But thank you for being here, and we're about to go for a break. But when we come back, Dr. Ernest Carter, who started the first telehealth program here in the USVI, will join us.
I am Dr. Cora Christian, inviting all healthcare providers to the first annual Digital Health Summit from July 25th to the 27th on St. Thomas, sponsored by the Governor's Office of health information technology. It is time we build a system to receive all, not some, of the information needed to improve the care of our patients and clients. This is our opportunity to have our voices heard. Do not miss this summit, for we will learn how to harness emerging technologies here in the territory to transform how we deliver and experience healthcare. The summit's website, www.ohitusvi.com, will provide you with additional information and help you to register as a guest, an exhibitor, or an event sponsor. And mark your calendar to attend from July 25th to the 27th. Welcome.
Hi, I'm Justa Encarnacion, Commissioner for the Virgin Islands Department of Health. On behalf of other providers and professionals working in the health IT space, let me invite you to our beautiful island of St. Thomas for the first annual Digital Health Summit to be held July 25th to July 27th. The healthcare industry is going through a phenomenal period of change. With technologies, our patients, customers, and communities are presented with endless possibilities. This conference was created for folks like you and me across the industry, working to improve the quality of patient care. The summit's website, ohitusvi.com, can provide you with additional information and help you register as our guest, an exhibitor, or event sponsor. So join us this summer and let's learn how to harness emerging technologies here in the territory to transform the ways we deliver and experience healthcare. Can't wait to meet you.
Good afternoon and welcome back. We're at our final day of the USVI Digital Health Summit, and I was able to speak with and interview two of our participants. One was our headline sponsor, one was one of our exhibitors here and a leading voice in health IT, Zing Technology. And joining me now, it's my pleasure to welcome Dr. Ernest Carter, who actually implemented the first telehealth program in the USVI. A very impressive, very funny gentleman who is impressive because of his credentials, but not only his credentials, but also because of his heart and his passion for intelligent medicine and for helping communities achieve a level of health that is optimal. Welcome, Dr. Carter.
Thank you, Director Francis.
I'd like you to first just help us all understand what telehealth is versus telemedicine, and then what did it look like to start the first telehealth program back in the 1990s? I can't imagine.
Well, first I want to just thank you for having me here, and thank you for your tireless effort on this project. This has been a wonderful summit. I've thoroughly enjoyed it, and I know we're going to have a great one next year. Now, to tell you a little bit about telemedicine, it's very simple. Telemedicine is the practice of medicine over an electronic network. And that involves doing e-visits, that involves mentoring doctors, that involves monitoring your patients at home so the doctor can know how well you're doing. That's all telemedicine, it's all clinical. Now, if you add other telehealth applications to that, beyond clinical medicine, which is like teleliteracy, telecare coordination, telepublic health, and it can keep going, mobile health that involves your telephone and mobile applications. Those applications are all umbrellaed, plus telemedicine under the big, capture all phrase telehealth.
All right.
So that's what telehealth is, and that's what telemedicine is. And so when in 1995, Dr. Malveaux, Floyd Malveaux, who was the dean of the College of Medicine at Howard University, asked me to look into how we might do telemedicine, not only in the United States, but in the world. And one of the first places we considered was the Virgin Islands, because at that time, the governor was Governor Roy Lester Snyder. He happened to be a Howard alum, and he was very enthusiastic about doing telemedicine in the territory. So after a lot of negotiations and determining how to do this and going through what you all currently are going through now, we decided to do a telehealth project, and we were able to implement a island-wide network that connected back to Howard University. And on May the 17th, May 17th, 1996, we were able to do our first video conference from Howard University to Roy Lester Snyder Hospital doing the grand opening. And from that point, we were able to move forward on doing telemedicine for a 2.5-year period.
That's very exciting. It was very enlightening, and it was wonderful to hear you share to be our keynote speaker, and to hear you share and to see the certificate that you received from Governor Schneider, to see the work plans and the workflow. At that time, it has changed dramatically, but so impressive. And I know one of the things that draws people in about you, for me, is your humility and your accessibility. But I do want to ask you to share a little bit about your history and your background. Share a little bit of your resume with us, so folks who weren't able to come to the summit know a little bit more about who you are as our keynote speaker.
Well, I'm a country boy. I was born in Jackson, Tennessee. I was born in Dyersburg, Tennessee, but grew up in Jackson, Tennessee. I went to Harvard undergrad. I was a physics major there. From there, I went to Harvard Medical School, and I majored in neuroscience, but I ended up going into pediatrics.
Wow.
And I did my residency at the Children's National Hospital in Washington, D.C. And after I finished my residency, I went on to get a PhD in bioengineering from the University of Pennsylvania. After I finished that, that's when I went to Howard.
Wow.
And I joined a group of engineers there in the Material Science Research Center. I was an associate for 5 years. And I taught electrical engineering, and I did work in biosensors. And then Dr. Malveaux pulled me over and said, this is this great thing called telemedicine. Do you want to think about that? And from that point, I got into telemedicine, health information technology. I still practice medicine. I did a lot of things in terms of opening retail clinics, owning businesses, still staying in HIT. I did medical informatics. But at the end of this journey, I ended up in public health. And that's where I am now. I'm the public health officer in Prince George's County, because that's where the journey takes you.
Yeah.
It takes you, especially if you're driven to help people who need help. If you want to get to equity, you end up doing public health. And you apply all of the principles, not only public health principles to what you're doing in public health as people know it, but to your health information technology, the way you govern how you govern that, and how you move forward with your workforce. It's all there.
And I want to hear more about that when we come back for a break. We'll be back in a few minutes with Dr. Carter to hear how public health should help drive the technologies we put in place.
The U.S. Virgin Islands are in a region with high levels of vulnerability and threats for tsunamis. Here's some tips you should know. Listen for the sirens. It is important to understand the difference between an advisory, a watch, a warning and an information statement.
If you're in a coastal zone area and notice a dramatic recession in water from the shoreline, move inland immediately and do not return until officials say it's safe to do so.
A tsunami can happen at any given moment, often without notice. Know your map and the nearest evacuation route and stay in the know.
Stay informed, stay prepared, and stay vigilant. Visit Vitema's website at vitema.vi.gov for more preparedness tips.
The more we know, the more we grow.
Good afternoon and welcome back. We are live at the Charles Turnbull Library where we've just concluded the USVI Digital Health Summit. We've heard from a few guests today that participated in our summit, and we're jumping to the Q&A segment. Here with me is Dr. Ernest Carter, who came as our keynote speaker, who was just sharing that he had started the first telehealth program in the USVI in the 1990s. So it was my absolute honor and pleasure to be able to invite Dr. Carter back to speak to us as our keynote speaker at the Digital Health Summit. So Dr. Carter, as we answer a few questions, I've got a question for you. How can telehealth help Virgin Islanders who need and seek care today?
Well, telehealth is designed to help you get medical care immediately. So if you have access to a device that can get you onto an electronic network, like a cell phone or your computer. So if you need help, it allows you to contact your physician and to be able to go through an actual visit with that physician so that you can get the care you need. Now, it can't do everything, but it can do quite a bit. As a matter of fact, 70% of the conditions that people have can be taken care of with telemedicine.
That's amazing.
Yes, so that's the reason why we want our people to have that, especially people who have to travel great distances, or it's a hardship for them to get to the doctor, or they have these social determinants which keep them from getting to the doctor like they should. But even people who don't would like the convenience of being able to talk to a doctor, whether it's a primary care doctor or a psychiatrist, or even a follow-up from maybe you had surgery and you need a follow-up just to talk to somebody about what happened to you. Telemedicine helps with that, and it's a critical part of the 21st century practice of medicine.
And very important to us here as Virgin Islanders who go off island to see specialists and we come back.
Exactly.
Typically, you'd have to return the price of a ticket to return to do a follow-up visit. But telemedicine and telehealth change that how?
Exactly.
In a specific example.
Exactly the way you said. For instance, and this happened in the 1990s. We were able to do this. When somebody had surgery at Howard, because a lot of people came from the U.S. Virgin Islands and they came to Howard to have their surgery. When they came back, they got their follow-up over the telemedicine system. And that saved them from going back and forth. It helped the surgeons to be able to follow their patients and keep up with their patients. It helped the patients to feel that they're connected back to the doctor who took care of them. Because most people don't want to do that. You want to be connected to the doctor who took care of you. And that's what telemedicine does. It helps to connect you, keep you connected. And it keeps your information following you. Well, it helps to keep your information following you when you're doing the visits.
So we've got a question from the audience that is an interesting one. Is a telemedicine or telehealth visit cheaper than a normal doctor's visit? And I think that could probably be answered in two ways. Is it cheaper for the patient? Is it cheaper for the provider?
The holy grail of telemedicine is that it shouldn't be cheaper or more, it shouldn't be more expensive or less expensive. It should be the same. That's what it should be. Currently, I would say it's about the same. I mean, a typical telehealth visit in the United States is $45 to $55 a visit. However, it depends on the nature of the visit, how long it is, et cetera. So in that way, it's consistent with what a visit would be if you went to a retail clinic like I don't know if you all have CVS mini clinics here.
No, we don't.
Yeah, but if you did, that's how much that would probably cost. So it's in the same ballpark.
Okay.
It's not overly expensive. However, we are fighting really hard to make sure it's covered by insurance.
Yes, yes. And I know there's the concern with the end of the public health emergency, which would take us far past this show, will allow us to talk about. So I want to get to another question from an audience member. So one of the questions that came in is, how will my doctor check my vitals over a video or whatever the telemethod is? How do they check your vitals?
Now, currently, there are devices that you can have at home that you actually can connect to yourself that'll give the doctor your vital information, your vital signs. And they come with a lot of telehealth units. Now, that's the way that would be ideal. However, there are ways to just enter your information into the system, where if you had a blood pressure cuff at home, you've got a scale, you've got your glucometer if you're a diabetic, and you can just put the information into the system and the doctor can check it there. So early on in telemedicine, we had devices, but some of them didn't work quite so well, et cetera. Sometimes the patient would actually just have to type their glucose reading or type their weight in. That's the way we did. And if we wanted to measure their respiratory rate, we watched you over video and we measured it. It was in those times. Now we have devices that can do that.
Like a Fitbit.
Fitbit, smart watches.
Smart watches.
Yes, and your cell phone itself. Right now you have a cell phone that can take your EKG. So, and they have so many devices that are coming out that are going to really cause telemedicine just to blossom.
And the applications, you download an app. There's an app for everything, including all levels of your health.
Absolutely.
So we'll take another question from our audience. This relates more in general to the safety of information coming in via telemedicine, or when we stand up an HIE and information being exchanged. How safe is information that is now transmitted electronically?
Well, let's start with a
complex question.
It is, but let's start with telemedicine. In order for telemedicine to secure your information, it has to be done over a secure network.
Yes.
The network has to be secure, but also the software on the ends have to be secure.
Yes.
Almost every component of it has to be secure. So currently, telemedicine is done over secure networks with secure software into records that are secure.
Yeah.
And that's demanded on any telemedicine system that's put in place, and of course the U.S. Virgin Islands would do that also. So your information is safe, and you should know that when you talk to your doctor and you set up your telemedicine appointment, you should know that we have to guarantee that if we're going to set up a telemedicine system in the U.S. Virgin Islands. So that's number one. Number two, over an exchange, the most important aspect of keeping your data secure over exchange is make sure your governance structure has entities that are making sure that your information is secure. It's not only the systems, but it's also the oversight of the systems. to make sure that those systems are up to date, to make sure they have all of the security that it should have. And you have to have experts who are constantly looking, because there's always people who are trying to hack into those systems. So it's a continuous process, and it's important that it's overseen, and that people have to trust the network before they'll even sign up for it. So there's a lot. You have to have a committee that oversees data security. You have to have committees that oversee the technical security. So it's complicated, but it can be done. I'm sorry.
Are there, do you know of, or have you heard of in your interactions with the providers, even at the summit, anyone that's providing telehealth services right now in the Virgin Islands?
I did. I heard that there were especially our FQACs were, and many people in private practice are providing telehealth services. And I was pleasantly surprised that they're doing that and successfully. So yes.
Yes, Pleasant Healthcare, we heard from Dr. Jan Tawakol.
That's right,
who came in virtually to the summit.
Yes.
And he shared that, as did our FQHCs who spoke.
And your maternal child system that you had in place, I actually interacted with it.
Stood up.
Absolutely,
Yes.
it looks great.
Yes, that's a full suite.
Yes.
Where they've utilized all the tools, where sometimes when we say telehealth, to your point, we're talking about even just a video consult. But having a whole suite, can you talk about what's in a telehealth suite?
In a maternal child suite, you would have the ability to do your fetal ultrasounds. You can check, well, of course, you'll check vital signs, and that information can be transferred to an OBGYN who's in the States or on Puerto Rico or anywhere if you're going to set up that telehealth consultation. So the suite will have a workstation that will allow you to do that. It actually gives you a whole virtual experience. So I was very impressed with that.
It's a real room with virtual tools.
That's right.
So someone can do a whole visit with you far away.
Far away.
Yeah. It's a pleasure having you here in the Virgin Islands. There's more content to talk about than we could ever squeeze into this segment. And I'm afraid we're going to have to go to another break. We could talk forever, but we thank you for being with us, and we're going to go to a final break.
The U.S. Virgin Islands are in a region with high levels of vulnerability and threats for tsunamis. Here's some tips you should know. Listen for the sirens. It is important to understand the difference between an advisory, a watch, a warning, and an information statement.
If you're in a coastal zone area and notice a dramatic recession in water from the shoreline, move inland immediately and do not return until officials say it's safe to do so.
A tsunami can happen at any given moment, often without notice. Know your map and the nearest evacuation route and stay in the know.
Stay informed, stay prepared, and stay vigilant. Visit Vitema's website at vitema.vi.gov for more preparedness tips.
The more we know, the more we grow.
Good afternoon and welcome back to our final segment here today. We've come to you live at the end of the USVI Digital Health Summit 2022. And here with me is Dr. Ernest Carter, and he's going to give us some of his final thoughts about the summit and his time here in the Virgin Islands again. And so we're going to give him a few minutes to share.
Thank you, Director Francis. Well, this is an exciting time for the U.S. Virgin Islands with the implementation of your vision in healthcare going to the 21st century with digital technology, making things available for our citizens that are going to make them healthier. And we know it. Yeah. We have opportunity. We have to take advantage of it. So I am excited. This particular conference is the kickoff of something great that's going to happen on the island. So I'd like to thank you all for having me. I really look forward to the next conference, but I really look forward to what's going to be done. So thank you so much, Director Francis. Thank you to the governor. we really appreciate the welcome that he gave us and moving us forward.
Yes, I would agree. It was an honor and a privilege to have our governor welcome you to Government House and then to kick us off in the morning. But I thank you for your generosity in your energy. You called me the Energizer Bunny earlier, but I think you're Senior Energizer Bunny. And clearly not an underachiever based on all that you've accomplished. So I am honored, and I'm holding you to your promise, not just to come back next year, but I will be reaching out to you week in and week out because we can so benefit from all that you know, all that you've done. And as you heard, as our governor said, now's the time. We're not pausing anymore. We're not taking the slow boat. We are launching full steam ahead. So thank you so much. I want to encourage all of you to visit us on the website. Again, my office is the Office of Health Information Technology, housed in the Office of the Governor, guiding all the health information technology initiatives across the government of the Virgin Islands, working with the public and private sector. You can find us at www.usvi.com. You can also find us on Facebook at facebook.com/OHIT-USVI. So that's facebook.com/OHIT-USVI. And remember, COVID-19 vaccines are now available for children 6 months and older. You can call the Department of Health to schedule an appointment and stay healthy. We thank you for your time with us this afternoon. God bless.